Deep Dive, the 2026 AI Regulatory Web in Insurance and Healthcare, February 16, 2026. Disclaimer: nothing in this report constitutes legal, medical, financial, or official advice. News is news, not legal, financial, or medical advice. Do not treat the following reports or anecdotal stories as advice or a call to action. Following up on today's earlier risk briefing, the insurance and healthcare sectors are facing a massive paradigm shift. As of January 1st, 2026, a sweeping slate of state-level AI regulations has gone into effect, fundamentally altering how algorithms can be used in underwriting, claims processing, and patient communication. Here is a deep dive analysis of the specific legal frameworks and regulatory pilots reshaping the industry right now. 1. California's human-in-the-loop mandates now in effect. California has aggressively positioned itself as the leader in healthcare AI regulation. Payors and providers operating in the state are currently overhauling their utilization management workflows to comply with three major bills that went live at the start of the year. SB 1120, the end of auto denials. Marketed by medical associations as a safeguard against algorithmic coldness, SB 1120 fundamentally changes how health and disability insurers handle claims. The core rule: an AI or automated decision-making tool can no longer be the sole basis for denying, delaying, or modifying a medical necessity claim. The human requirement: the law mandates that a licensed physician or competent healthcare provider must review the individual clinical circumstances before a denial is issued. The impact: health plans that previously used AI to instantly auto-deny claims based on group datasets or missing coded criteria are now scrambling. This has drastically increased the demand for licensed medical directors to physically review flagged claims, leading to a bottleneck in utilization management departments. AB 489, banning DoctorBot. This law tackles the deceptive use of generative AI in patient-facing portals. The core rule: developers and deployers of AI systems are prohibited from using titles, letters, like MD or RN, icons, or phrasing that falsely implies the AI possesses a healthcare license. The impact: insurance customer service chatbots and telehealth triage bots must clearly state their non-human nature. Any implication that a licensed professional is overseeing the bot's direct output, unless actual, real-time supervision exists, is now a sanctionable offense. SB 243, the Companion Chatbot Act. Geared toward mental health and digital therapeutics, this law regulates AI designed to provide emotional support. The core rule requires recurring, conspicuous disclosures, especially to minors, that the user is interacting with an AI, not a real person. Safety protocols: it mandates built-in protocols to detect and prevent the AI from generating responses regarding self-harm or suicidal ideation, requiring the system to immediately refer the user to human crisis services. 2. The NIC AI Systems Evaluation Tool pilot. While state legislatures focus on healthcare, the National Association of Insurance Commissioners, NAIC, is targeting the financial and underwriting sides of the house across all lines of business, life, health, and property and casualty. Following heavy debate in late 2025, the NAIC is officially launching its pilot program next month, March 2026. How the pilot works. The participants: 9 states have stepped forward to administer the pilot, including Colorado, Iowa, Virginia, Pennsylvania, and Florida. The scope: regulators will use the tool to audit selected domestic insurers during standard market conduct exams and financial analyses. The focus: the tool is rooted in proportionality. Regulators are spending less time on AI used for back-office data entry and zeroing in on high-risk models, specifically algorithms used for pricing, risk scoring, coverage denials, and fraud detection. What the tool evaluates. Insurers subjected to the pilot must open their black boxes to prove. Algorithmic bias testing: evidence that the insurer regularly tests its models, including third-party vendor models, for discriminatory impacts or proxy bias. Governance and accountability: documentation proving that a human executive or board holds ultimate responsibility for the AI's actions. Traceability, the ability to explain exactly how an AI model arrived at a specific underwriting or pricing decision if a consumer files a complaint. The industry pushback. Trade groups have been highly vocal in their opposition to the tool's current iteration. Their primary grievance is that participation in the pilot is compulsory for the insurers selected by the pilot states. Furthermore, actuaries are arguing over definitions. Insurers are lobbying to exempt traditional generalized linear models, GLMs, and basic predictive analytics from the intense scrutiny applied to modern generative AI and deep learning models. 3. Texas and the expanding regulatory map. While California and the NAIC dominate the headlines, the regulatory web is national. Texas TRIGA, the Texas Responsible Artificial Intelligence Governance Act, effective January 1, 2026, imposes strict disclosure requirements on licensed healthcare practitioners, mandating conspicuous written disclosures if AI is used in a patient's diagnosis or treatment. The federal collision. Looming over these state efforts is a new executive order from the federal government aimed at establishing a uniform national AI policy. A federal AI litigation task force has been directed to evaluate if state laws, like California's, are overly burdensome and should be preempted by federal authority, setting the stage for massive legal battles later this year. Would you like me to transition from the regulatory side and draft a report on how major insurance